உறவுகளுக்கு கணக்கு நாங்கள் தற்போது இலங்கையினுடைய ஜாழ்ப்பாணம் மாவட்டத்தில் வடக்கு மாகாண பிரதம செயலாளர் அலுவலகத்தில் அணிக்கிறோம். இங்கே சுகாதார அமைச்சர் ரமேஷ் பத்ரன் தலைமையில் வடக்கு மாகாணத்தில் இருக்கக்கூடிய சுகாதார பிரச்சனைகள் தொடர்பில் முக்கிய கலந்துரையாடல் இடம்பெறுது. யாழ்ப்பாணத்தில் சாவச்சேரி ஆதார வைத்தியசாலை தொடர்பான பிரச்சனைகள் தற்போது சூடுபிடித்திருக்கும் நிலையில் சுகாதார அமைச்சர் யாழ்ப்பாணத்துக்கு விஜயம் செய்து வைத்தியசாலைகள் தொடர்பான பிரச்சனைகள் ஆராயும் போது சாவகச்சேரி பிரச்சனை தொடர்பிலே பேசப்படும் என பலராலும் எதிர்பார்க்கப்படுது. இங்கே நாடாளுமன்ற உறுப்பினர்கள் வருகிறார்கள். அது தொடர்பான காட்சிகளை பார்க்கலாம்.
It's yet another important day in our province where the Honorable Minister, Health Minister, Dr. Ramesh improvement in the province. So, first of all, I warmly welcome the Honorable Minister, Dr. Ramesh Patrana, to the Northern Province.
நாடாளுமன்ற உறுப்பினர்களான அங்கயன் ராமநாதன், தர்மலிங்கம் சீதாத்தன், சிவஞானம் ஸ்ரீதரன், சார்ஸ் நிர்மலநாதன் ஆகியோர் வருகை தந்திருக்கிறார்கள்.
From the government of Netherlands. I have listed created facilities. Secretary also mentioned a lot of things. So we have an unit with 18 beds and 5 HDU beds, a radiology unit with CT scanner, high-end CT scanner, X-ray machine and ultrasound scanners, surgical ward, maternity ward. 5 operating theatres. In addition to that, we have some other casualty. Now they have shifted most of the facilities to the new unit.
சுகாதார அமைச்சர் தலைமையில் நடைபெறக்கூடிய இந்த கலந்துரையாடலுக்கு வைத்தியர் அர்ஜுனா அவர்களும் வருகை தந்திருக்கிறார். முக்கியமாக சாவச்சேரி பிரச்சனை தொடர்பில் இதில் கலந்துரையாடப்படும் எதிர்பார்க்கப்பட்ட நிலையில் அர்ஜுனாவும் வருகை தந்தமை ஒரு பரபரப்பை ஏற்படுத்தி இருக்கின்றது. தொடர்ச்சியாக இணைந்திருங்கள்.
Bed occupancy is 56%. So 44% beds are not utilized. Is only when it comes to the
வடக்கு மாநிலத்தில் நிலவக்கூடிய சுகாதார பிரச்சனை தொடர்பில் நாடாளுமன்ற உறுப்பினர் தங்களுடைய உரைகளை முன்வைக்க இருக்கிறார்கள். என்ன நடக்க போகுதுன்னு சொல்லி பார்ப்போம்.
முக்கியமாக இன்றைய ஒரு நல்ல நாள், தமிழர்களுடைய ஆடிப்பிறப்பு நன்னாளில் வருகை வந்திருக்கின்ற அமைச்சர் மருத்துவர் ரமேஷ் பத்ரன் அவர்களே மற்றும் ஏனைய பிரமுகர்களே, உங்கள் அனைவருக்கும் என்னுடைய அன்பான வணக்கம். நான் நினைக்கிறேன் இன்றைக்கு எங்களுக்கு ஒரு மிகப்பெரிய திருநாள். அமைச்சருக்கு ஆடிக்கூலோடு வரவேற்றிருக்கணும். நாங்கள் விட்டுட்டோம், எங்களை நாளை நாங்கள் சொல்ல மறந்துட்டோம். பரவாயில்லை. கௌரவ அமைச்சர் அவர்களே, நான் நினைக்கிறேன் நாங்கள் குறைகளை சொல்கிறோம் அல்லது ஏதாவது பிழைகளை சொல்கிறோம் என்பதெல்லாம் முக்கியம். மிக முக்கியமாக பல பிரச்சனைகள் இருப்பதை நான் சொல்கிறேன். உதாரணத்துக்கு வடக்கு மாகாணத்தினுடைய சுகாதார பணிப்பாளர் ஒரு ப்ரெசன்டேஷன் செய்திருந்தார். அவர் அதில் தேவைகள் என்ன அல்லது எவ்வளவு இருக்குன்னு அப்படி சொல்லாமல் இருக்கிறத சொன்னார். ஆனால் எவ்வளவு தேவை என்றதை என்னென்னத்தில் தேவை எங்களுக்கு எவ்வளவு இருக்கின்றதை தெளிவாக அவர் சொல்ல இல்லை என்று நான் நினைக்கிறேன். மிக முக்கியமாக பல வைத்தியசாலைகளில் பல குறைபாடுகள் உண்டு. அந்த குறைபாடுகளை நிவர்த்தி செய்கிறதுக்கு உடனடியாக சாத்தியப்படாதென்றாலும் ஆனால் நீண்ட நாள் கோரிக்கைகள் உண்டு. குறிப்பாக சிடிசி ஸ்கேன் பல வைத்தியசாலைகளில் இருப்பதாக ப்ரெசன்டேஷனில் சொல்லப்பட்டது. ஆனால் இன்றைக்கு கிளிநொச்சியில் இருக்கிற சிடிசி ஸ்கேன் இயக்கிறதுக்கான தொழில்நுட்ப உத்தியோகத்தர்கள் இல்லை, அது இயங்காமல் இருக்கு. அப்படி இல்லை என்றால் வேறு வைத்தியசாலைகளுக்கு தேவை என்றால் அவர்கள் பேஷண்ட்டோடு வந்து அவர்களுடைய தொழில்நுட்ப உத்தியோகத்தோடும் வந்து தங்களுக்கான சிடிசி ஸ்கேனையும் எடுத்துட்டு சில வேளைகளில் கிளிநொச்சி ஹாஸ்பிட்டலுக்கும் ஹெல்ப் பண்ணிட்டு போனார்களே தவிர, ஆனால் கிளிநொச்சி கிட்ட இன்னும் அந்த கார்டை கிரியேட் பண்ணப்படலை. இப்போ இன்றைக்கு ஒரு பெரிய அளவான அமௌண்ட்டோட 2000 மில்லியன் ரூபாய் நெதர்லாண்ட் ப்ராஜெக்டாக கொண்டு வரப்பட்ட நான் நினைக்கிறேன் அந்த டைம் அது ஸ்டார்ட் பண்ணப்படுற நேரம் கிளிநொச்சியினுடைய எம்எஸ்ஸாக டாக்டர் குமரவேல் அவர்கள் இருந்தார். அது ஆரம்பிக்கப்பட்ட நேரத்தில் அந்த ஒரு திட்டம் வடக்கு மாகாணத்துக்கானதாக இருந்தது. இன்றைக்கும் அப்படி இருக்குது. ஆனால் அங்கே இருக்கிற கார்டர்ஸ் அதுக்கு நியமிக்கப்பட்டு இன்னும் செய்வதற்கான எந்த முன்னாயத்தங்களும் செய்யப்படலை. இது ஒரு கிட்டத்தட்ட அந்த கிடைத்திருக்கிற வளத்தை பயன்படுத்த முடியாமல் இருக்கிறது என்பதையும் நான் இந்த இடத்துல குறிப்பிட விரும்புகிறேன். இதே போல் உணர்வல் அங்கேயன் அவர்கள் சொன்னது போலையும் நான் அதை குறிப்பிட்டிருக்கிறேன். தீவு பகுதி வைத்தியசாலைகளில் பல குறைபாடுகள் இருக்கு. உதாரணத்துக்கு நெடுந்தீவு என்பது ஒரு தனி பிரதேச செயலாளர் பிரிவு இலங்கையில். ஆனால் அங்கே ஒரு ஆம்புலன்ஸ் போர்டு இல்லை. அங்கே இருக்கிற மிந்தி போனால் நேவியின் உதவியோட ஒரு ஆம்புலன்ஸ் படகுல நோயாளர்களை ஏற்றி இறக்கலாமே தவிர ஆபத்தானவர்களை உடனே மாற்றத்துக்கான உள்ளூர் சேவையும் கூட மிக குறைவு. நைனாதீவு, அனலதீவு, எழுவதீவு போன்ற இந்த தீவுகளில் இருக்கிற வைத்தியசாலைகளில் நிரந்தரமான வைத்தியர்கள் கூட அடிக்கடி மாற்றப்படுறாங்க. சில நேரங்களில் வைத்தியர்கள் இல்லை. அதே போல் வடமராட்சி கிழக்கில் இருக்கிற அம்பன் வைத்தியசாலை, சாவகச்சேரியில் இருக்கிற பரணி வைத்தியசாலை, முல்லைத்தீவு, வவுனியா, மன்னார் போன்ற இடங்களில் பின்னிலையில் உள்ள பல வைத்தியசாலைகள் மிகப்பெரிய குறைபாடுகளோடு இயங்குகின்றன. சரியான ஒரு ஆவணப்படுத்தல் வேணும். இவற்றுக்கான தீர்வு ஒன்று ஏற்படுத்தப்பட வேணும். அண்மையில் பேரவில் பகுதியிலிருந்து கூட உடனடியாக நோயாளர்களை கொண்டு செல்ல முடியாததால் 6 மாத காலத்தில் 2 மரணங்கள் நடந்தது. நான் கவர்னருக்கு அது பற்றி கடிதம் எழுதிய பொழுது ஆளுநருடைய பெரும் முயற்சியால் அந்த வீதி உடனடியாக 30 மில்லியன் ரூபாய் செலவுகளில் உடனே செய்யப்பட்டு இப்போ ஓரளவுக்கு அந்த பேஷண்ட்ஸுக்கு ஒரு அவசரம் என்றால் பேஷண்ட்ஸ் உடனே கிளிநொச்சிக்கோ முழங்காவிற்கோ மாற்றப்படுறார்கள். காரணம் அதுக்கு ஆளுநருக்கு நாங்கள் நன்றி சொல்ல வேண்டும், அவருடைய அந்த பெருமுயற்சி. அதே போல் இலங்கையில் இருக்கின்ற பல இடங்களில் தாதியர் குறைபாடு இருக்குதான். ஆனால் இங்கே இருக்கிற தாதியர் குறைபாடு என்பது ஒரு வித்தியாசமானது. டாக்டர்ஸுக்கும் சிலர் இங்கே வர்றார்கள் இல்லை, நீங்கள் குறிப்பிட்ட காலத்தில் நீங்கள் உங்களோட இடத்துக்கு போகலாம். அதே போல் தாதியர்களுக்கும் ஒரு குறிப்பிட்ட காலம் பேர் செய்தால் போகலாம் என்ற அடிப்படைகளில் தாதியர்களுக்குரிய அந்த நியமனம் நிறைய இடங்களில் வேக்கண்டாகவே இருக்குது. அது ஒரு மருத்துவத்துறையில் ஒரு மிகப்பெரிய பின்னடைவு இந்த பகுதிகளில். ஆகவே தாதியர்களுடைய குறைபாட்டுக்கு என்ன மெக்கானிசம், என்ன ஒரு பொறிமுறையை எவ்வாறு உருவாக்குறது. அதே போல தான் தாதிய குறைபாடு போல தொண்டர்கள், இப்போ மிட்வாயும் அட்டெண்டன்ஸ் போன்றவர்களுடைய குறைபாடுகளும் மிகப்பெரிய அளவில் இருக்கு. உதாரணத்துக்கு சிற்றூழியர்கள், பல இடங்களில் பல வைத்தியசாலைகளுக்கான சிற்றூழியர்கள் இல்லாத குறைபாடு மிகப்பெரிய அளவில் காணப்படும். எப்படி அந்த வைத்தியசாலைகளை கொண்டு இயக்கிறது? ஏற்கனவே கௌரவ ஆனரபிள் மினிஸ்டர், ஏற்கனவே நான் நினைக்கிறேன் தொண்டர்களாக இருந்தவர்களுக்கு நியமனம் வழங்குவதற்கான நேர்முகம் நடந்தது. ஆனால் நேர்முகம் நடந்து அவர்களுக்கு நியமனம் வழங்கப்படவில்லை. அப்போ அவர்களுக்கு நேர்முகம் நடத்தி காலம் 2019ஆம் ஆண்டில் கோல் பண்ணப்பட்டு நேர்முகம் நடந்தது. இன்றைக்கு 2024 ஆகியும் அவர்களுக்கான நியமனம் வழங்கப்படவில்லை. அந்த நியமனங்கள் வழங்கப்பட்டாலே ஓரளவுக்கு இந்த ஆளணிகளில் இருக்கிற விஷயங்களை நாங்கள் ஓரளவுக்காவது ஒரு செட்டில்மெண்ட்டில் கொண்டு வரலாம். ஆகவே நிறைந்த அளவான தேவைகள் இருக்குது. நான் நினைக்கிறேன் பல தடவைகள் பாராளுமன்றத்துக்கு நான் 2010ஆம் ஆண்டு வந்த பொழுது நான் நீங்களும் பக்கத்து ஆசனங்கள், அதில் ஏற்பட்ட ஒரு நட்பு இன்றைக்கும் அந்த நண்பர்களாக இருக்கிறோம். நான் நினைக்கிறேன் நீங்கள் ஓரளவுக்கு கரிசனை போடுறீங்கள். நான் அண்மையிலேயும் நான் ஒரு வடக்கு மாகாண மருத்துவ பிரச்சனைகளை பேசுகிற பொழுது நீங்கள் சொன்னீங்கள் நாங்கள் ஒரு முறை முக்கியமானவர்களை அழைத்து பேசுகிறதுக்கு நாங்கள் தயாராக இருக்கிறோம் என்று. அதே போல் மாவட்ட ரீதியான வைத்தியசாலைகளின் பிரச்சனைகள், அண்மையில் கனடா நாட்டிலிருந்து என்னுடைய நண்பர் செந்தில்குமரன் அவர்கள் எங்களுடைய வேண்டுகோளுக்கு நாங்கள் ஜெஃப்னா ஹாஸ்பிட்டலுக்கு ஒரு 4 கோடி ரூபாய் பெறுமதியான மருத்துவ உபகரணம், மல்லாவி வைத்தியசாலை, முல்லத்தீவு வைத்தியசாலை, சாவகச்சேரி வைத்தியசாலைக்கு அவர் தன்னுடைய உதவிகளை செய்திருந்தார். அவர் இன்றைக்கு நேற்றில் பல நாட்களாக இந்த பணிகளை ஆற்றி வாரார். இப்படி பல பேர் இப்போ சாவகச்சேரியில் இருக்கிற தென்மராட்சி அபிவிருத்தி ஒன்றியம் நிறைந்த அளவில் அந்த வைத்தியசாலைக்காகவும் மருத்துவத்துக்காகவும் உதவுகிறார்கள். அவை புலம்பெயர் நாடுகளில் இருக்கிற டயஸ்போரா தமிழர்கள் செய்கிற அளவுக்கு நாங்கள் அவர்களை ஊக்கப்படுத்துறதாக இருந்தால் சில நியமனங்கள் உத்தியோகத்தர்களுடைய அளவுகள் கூட்டப்பட வேண்டும். அதை நான் நினைக்கிறேன் அதிகமான கரிசனை கொள்வீங்கள் என்ற நம்பிக்கையோடு என்னுடைய பதிவுகளை செய்கிறேன். குறிப்பாக நான் நினைக்கிறேன் நான் பேசுகிற மொழி உங்களுக்கு விளங்காமல் இருந்தால் இந்த ரெக்கார்டை எடுத்து திரும்ப ஒரு முறை நீங்கள் அதை கேட்டென்றாலும் இந்த விஷயத்தில் கவனம் எடுக்குமாறு கேட்டுக்கொள்கிறோம்.
இந்திய அரசாங்கத்தோட உதவியோட மன்னாரில் ஓபிடி ஓடும், முல்லைத்தீவில் போட் காம்ப்ளெக்ஸும் 600 மில்லியன் ரூபாயில் செய்தாரதான் உடன்பட்டாங்க. அதுக்கு கவர்னர் தான் அந்த ரிக்வெஸ்ட்டை, இதுக்கு முதல் கவர்னராக இருக்கேக்கல அந்த ரிக்வெஸ்ட்டை போட்டிருந்தேன். அது தொடர் நடவடிக்கையாக இருக்குது. ஆனால் இன்னும் அது முற்றுப்பெறவில்லை என்பதை நான் இந்த நேரத்தில் அமைச்சரை கவனத்துக்கு கொண்டு வரேன். குறிப்பாக இந்த தொடர் முயற்சியை நீங்கள் எடுக்க வேணும். இந்த 2 மாவட்டங்களும் அந்த ஒரு ஹெல்த்தில் ஒதுக்கப்பட்ட மாவட்டங்களாகத்தான் நான் பார்க்குறேன். குறிப்பாக வடக்கு என்றால் மத்திய அரசாங்கத்தில் இருக்கிற அமைச்சர்கள் யோசிக்கிறது ஏனைனத்தான் வடக்காக யோசிக்கிறது ஒழிய வடக்கில் 2 மாவட்டங்கள் இருக்கிறதாக மத்திய அரசாங்கம் நினைப்பது குறைவு. அந்த வகையில் தான் இந்த நெதர்லாந்து ப்ரொஜெக்ட் கூட அதில் ஒரு மாவட்டம் விடுபட்டது. வடக்கு கண்ட வந்த நிதியில் முற்றுமுழுதாக மன்னார் மாவட்டத்துக்கு அந்த எந்த விதமான ஒரு திட்டமும் ஒதுக்கப்படையில. அப்போது ராஜதேசேனரன் அமைச்சராக இருந்தவர், நான் கேட்டபோது ஓபிடி பில்டிங்கில் அரசாங்க காசில் கட்டித்தாருன்னு சொல்லி சொன்னவர். அந்த நேரம் 1517 மில்லியன் எஸ்டிமேட் போட்டிருந்தது. ஆனால் இப்போ அதுக்கு 600 மில்லியன் தான் இப்போ இந்திய அரசாங்கத்தின் உதவியோடு உடன்பட்டிருக்கணும். ஆகவே இந்த மதிப்புக்குரிய செயலாளரும் குறிப்பிட்டது ஹெல்த்தில் பல வளங்கள் வடக்கில் இருக்குன்னு குறிப்பிட்ட நேரத்தில் இந்த A9 இருக்கிற வைத்தியசாலைகள் தான் பிரதானமான ஒரு இடத்தை பிடிச்சது என்பதை நான் இந்த நேரத்தில் சொல்லிக்கொள்ள விரும்புகிறேன். ரெண்டாவது, இந்த மன்னார் முல்லைத்தீவில் பெர்மனன்ட் கன்சல்டன் இல்லை. பெர்மனன்ட் கன்சல்டன் இப்போ கன்சல்டன் மாதிரி வரையினம் 2 மாதத்தில் 3 மாதத்தில் திருப்பி போயிடும். பெர்மனன்ட் கன்சல்டன் இல்லாதால அந்த இன்டர்ன்ஷிப் டாக்டர்ஸும் இல்லாமல் இருக்குது. இப்போ குறிப்பாக யாழ்ப்பாணத்தில் ஜென்ரல் ஹாஸ்பிட்டலில் இருக்குது, தெல்லிப்பள்ளியில் இன்டர்ன் இருக்குது. அப்போ ஒரு டிஸ்ட்ரிக்டுள்ள 2 இடத்துல இருக்குது. நாளைக்கு இலங்கையில் பெர்மனன்ட் டாக்டர்ஸ் இல்லாத மாவட்டங்களாக மன்னார் முல்லைத்தீவு மாவட்டம் 2ம் தொடர்ச்சியாக இருந்து கொண்டு வருகிறது. அப்போ இதில் வந்து பெர்மனன்ட் கன்சல்டன் இல்லாதால ஒரு பெரிய பிரச்சனையை 2 மாவட்டங்களும் சந்தித்து கொண்டிருக்கு. அதை விட நான் நினைக்கிறேன் முதல் முல்லைத்தீவு RDHS இருந்த டாக்டர் அகிலேந்திரன், நான் புதுக்குடியிருப்பு டிரெக்டர் 3 பேரும் அமைச்சரையும் உங்களை செயலாளரை சந்தித்தது புதுக்குடியிருப்பு ஹாஸ்பிட்டலில் இருக்கிற டாக்டர்ஸ் பிரச்சனை சம்பந்தமாக. இப்போ புதுக்குடியிருப்பு பேஸ் ஹாஸ்பிட்டலாக ஆரம்பிக்கப்பட்ட போதும் இன்றைக்கு பீடி வந்து அது பேஸ் ஹாஸ்பிட்டலாக சொன்ன போதும் அமைச்சராக பேஸ் ஹாஸ்பிட்டலாக இன்றைக்கு இல்லை. என்னென்னா புதுக்குடியிருப்பில் இருக்கிற பாப்புலேஷன் அடிப்படையில் நீங்கள் பார்த்தீங்கன்னா அங்கே இருக்கிற ஒரு மிகப்பெரிய ஒரு சிரமத்துக்கு நான் 2-3 தரம் புதுக்குடியிருப்பு ஹாஸ்பிட்டலுக்கு விசிட் பண்ணினேன். நேற்று புதுக்குடியிருப்பில் நான் நின்ற போது வெளியாலேருந்து பார்த்தபோது ஓபிடிக்கு இருக்கிற பேஷண்ட் என்றால் சொல்லலாது அவ்வளவு பேஷண்ட். அதில் ரெக்கார்டு நான் உங்களுக்கு தந்திருக்கிறேன். ஆனால் 2 டாக்டர்ஸ் தான் அங்கே மாறி மாறி ஓபிடி பேஷண்ட்டை பார்த்து கொண்டு இருக்கிறேன். ஏதோ ஒரு அரேஞ்ச்மெண்ட் இல்லை, இம்மீடியட்லியாக அந்த புதுக்குடியிருப்பு ஹாஸ்பிட்டலுக்கு உடனடியாக டாக்டர்ஸை நியமிக்கணும் என்று நான் கேட்டுக்கொள்கிறேன். மற்றது குறிப்பாக மன்னார் டிஸ்ட்ரிக்டை பொறுத்தவரை சிடி ஸ்கேன்ன்றது ஒரு பிரதானமான இது இலக்காக இருக்குது. இப்போ ஆசியாவிலேயே நவீன சிடி ஸ்கேன் கிளிநொச்சியில் இருக்குது. ஆனால் மன்னார் மாவட்டத்தில் சிடி ஸ்கேனே இல்லை. නෑ ඇමතුමා මන්නාරමේ නෑ මම 2018 ඉඳලා මේක මම කතා කරනවා. ඒකයි ප්‍රශ්නේ. දැන් මම අද වන්නේ ඩිස්ට්‍රික්ට් එකේ මෙතන ඇවිල්ලා ඉන්නේ മന്ത്രി මම විතරක් ඇවිල්ලා ඉන්නේ. හරිද? මම දැන් ඕම්ලි දැන් ඔබතුමා දැන් අර ඉස්සර 2018 දැන් ප්‍රෙසිඩන්ට් රනිල් වික්‍රමසිංහ ජනාධිපතිතුමා ඒ කාලේ අගමැති ඒ කාලේ දුන්නා. මම පාර්ලිමේන්තු එකේ යෝජනා ගෙන ආපු ගම දුන්නා. එතකොට ඒ කාලේ හිටපු ඩිරෙක්ටර් අර බිල්ඩින් වැඩ ඉවර නැහැ කියලා ගත්තනේ. ඊට පස්සේ වෙන ඩිස්ට්‍රික්ට් වලට දුන්නා. දැන් ඒ කාලේ ඉඳලා බිල්ඩින් හදලා ඉවරයි අවුරුදු 4ක් පවවලා. දැන් CT ස්කෑන් වලට ට්‍රාන්ස්ෆර් කරනවා Jaffna අනුරාධපුර ක්ලිනික්. එහෙම ට්‍රාන්ස්ෆර් කරන දවසට ඇම්බුලන්ස් 3ක් වැඩ කරනවා ඒකට විතරයි. ඒ නිසා මම දැන් නෙක්ස්ට් ඉයර් කියලා කියන්නේ නැතුව මේ අවුරුද්ද ඇතුලේ දුන්නොත් හොඳයි. මේ CT ස්කෑන් එකේ තමයි ලොකු ප්‍රශ්නේ. දැන් RDHS උත් ඉන්නවා. එයා මඩු පල්ලියේ මට ප්‍රොපෝසල් දෙනවා. මඩු පල්ලි පූජාවේ RDHS ප්‍රොපෝසල් දෙනවා. තියෙන අඩුපාඩු ටික. දැන් ක්ලිනොච්චි වලට තිබ්බට
I'd like to thank the Honourable Minister to visit the North and see the situation by himself. I believe that the present crisis or any crisis in this health sector in the Northeast or anywhere is not because of the doctors or the administrators, because of the politicians. Why I say this is I finished. Let me finish. Why I say this is because the health is a devout subject, but still it is not fully devolved, one thing, with high respect to the minister because he doesn't see that way. Because of that, a lot of things have to go to Colombo, come back, go to Colombo, come back. Because of that, a lot of things are happening. What happened in Savacheri is nothing to do with any outsiders. This is by a doctor who was the one who blamed a lot of things, who put a blame on the doctors and the administration, everybody, even on Colombo. But personally, I don't take that seriously because I believe it is exaggerated. One, there are certain things happen that is different. But if he really wanted, he would have sorted out with the higher ups and finished the matter. But it's like how can I say, political or a sort of try to boost himself up. This is what I think. Well, what he said, there are certain truths there that I don't deny it, but he would have sorted out. He would have done it. And I believe certainly the doctors and the administrators in the north, generally in the country, they're really dedicated to the patients and they really work hard, dedication, hard. I think slowly we can certainly correct all these things and the medical service can be seen by the people as somebody who, most of them are dedicated and working hard for the people. But these propagandas are, I don't think all the people believe it. So the doctors no need to get agitated about it because the ordinary people, they really don't believe it. Majority of them, or some of them it is, they believe certain things happen. And because of as Honorable Angan says, certain things happened in the hospital, certain deaths and things like that, agitated the people. So now that's the reason. That is the main reason why the people are agitated. I don't see a large number of them were there. Still, it's not good for the medical profession. It's not good for the health service. I think certainly the Honorable Minister look into it and put the things right. Thank you.
I thank Honorable Minister Dr. Ramesh Pattarana for coming to Jaffna and seeing how to improve the health system in the Northern Province. And I thank Honorable Governor also for creating such a forum to discuss about the improvements in the health sector. Today I would like to highlight a few things that has been happening recently that has actually come in the media as well regarding the Chavacheri issue. However, this is not because of the Chavacheri issue that has happened. The people have been having some serious concerns from previous occasions. But on the issue of the Chavacheri, where this doctor has been sharing some information on the Facebook, which has actually triggered the people also with the same thoughts. So I would just like to highlight some of the issues. The important issue is that I think the people feel, I'm just talking from the point of view of the people here, Honorable Minister, that there is a lack of transparency in what is happening in the hospital administration and hospital development with regards to, that is not shared with the people. Because I believe this hospital is for the people and they are part of this, they are stakeholders of this development. So I think, so for instance, some issues that have happened in the hospitals, some unfortunate deaths, which there have been inquiries set up, but there is no result on those inquiries given to the public. So those things could be handled properly, I believe, because people are also looking forward to what is happening and proper actions are being taken. And secondly, there's particularly some storage of these drugs and Honourable Minister, on the storage of these drugs and all these at some of the base hospitals and some of the periphery hospitals are not maintained properly, some of the complaints of the people. And also when they go to these hospitals for some of these surgeries, I'm not complaining about everyone here, some of these surgeries, they've been asked to bring some of the like equipments to do during the surgery, because they say that the equipments in the hospital, I mean like probably like clips and some medications in the hospital are not of this proper standard. So that is also giving the people a wrong message. And I would like to assert what Honorable the Secretary of Health said, that there is a lot of resources available in the Northern Province. We are not going to ask for more resources, but we would like the provincial and the central to work together to reduce this, because there is a lot of people being transferred from these base hospitals which have capacity and which have the resources, but are underutilized and sent to the teaching hospital. Where teaching hospital we see a lot of patients sometimes or even on the floor. Honorable Minister, since you visited both these places and everything, I believe you have a first-hand, you have seen it first-hand. So I hope there will be proper changes on this. Thank you, Honorable Minister.
When the ministers come, they think teaching hospital is the only hospital to be treated with, and they treat the provincial health sector as a secondary or something. I have taken up this issue because I was the leader of opposition of this council some time back. So I have taken up this position many times that what the Constitution has given, the 13th Amendment has given, is not properly adhered to. Though it is in the text, by arrangement, most of the powers that should have been vested with the governor is slowly taken over at the center. So I will be having a detailed discussion later. Thank you for giving due consideration to listen to the provincial administrators. Before coming to Chavacheri is the hot issue, because we are only a few kilometers away from Chavacheri right now. But I will take up some other issues first. Honourable Minister, during the time of crisis, there were volunteer health workers. I don't know, you call it some other name, but they are known as volunteer health workers. They have worked voluntarily for a long period of time. The Honourable Maithripala Srisena, when he was the president, when he visited Jaffna, these people made a representation and he appointed a committee chaired by Mr. Austin Fernando to look into their grievances. I think Mr. Ilangovan also in that committee and discussed all the matter. 802 people were authentically given a list by the provincial administration that they are qualified to be absorbed into the permanent cadre. There is cadre vacancy also, not 802, little lesser than that. So these people, I must remind you, Honourable Minister, when your father was the Minister of Education, I was a Member of Parliament. He had taken the bold initiative at the request of Honourable Ratnatha to recruit the voluntary teachers who had been serving during difficult time in North as teachers into permanent cadre. On condition they had to go to the training college and get qualified subsequently. So likewise, I expect you too to take some decision in this regard and see these volunteer health workers who had been working as in the MOH offices and other periphery units. Because it is a long-standing issue, I think the secretaries would know that they need to be, I think Honourable Governor also had made the request in this regard. So please consider this request and you can make either through a cabinet paper or whatever it means But the same way your father, at the time they have opposition to recruit teachers, volunteer teachers, because there was similar volunteer teachers in the south. But he made a justification. Those people worked during wartime. During the time there was crisis in the country when all the other people left. So likewise, please give some consideration to this. And also, as pointed out by Honorable Ramanathan, we also, Honorable Minister wants to mention about this. Ambulance boats, it is a necessity to serve within the, now only the Navy is helping, particularly to Nedindiv and adult. So please try to see whether you could get some funding to get a ambulance boat. And also there is a request now, the center has recruited some SKS, known as for dengue. So they are also working for something. Now they are agitating Honorable Minister to get them some sort of, I don't know whether they are on a casual basis, I suppose. Casual basis. So there is a request from them to consider their request and all. So please look into it. And also, I think the wastewater treatment plant in the teaching hospital, I think they have, I'm sorry, Mr. Satyamurthy, only thing there is a complaint because you know we are depending on groundwater. So if anything that gets into the ground, very difficult to treat it again. So we must ensure that there is a good facility for wastewater treatment. It is very otherwise, because there is already complaint that the treatment plant is leaking, so many other issues coming out and it's mixing with the groundwater. So please look into that because that is a serious issue. If it mixed with the groundwater, then that is another problem. Then also report to the nurses issue. Even our Honorable Minister made a request long time ago to reduce their qualification or revise the qualification. Not necessarily to make it equivalent to some other. But as pointed out by Honorable Governor, the union were opposing it. So better negotiate with the union to give a we did. There was a cabinet paper and it all got, because of the trade union opposing that, so better deal with them. It's on units. Yeah, but there's a real problem for the north. So consider some special arrangement at least for a certain period of time, not permanently.
If the intake is district-wise, then there's more chance. National-wise, our students can't actually
compete with them.
National-wise. At least special consideration if you notice that district-wise, then the people from here will be.
And I think during my period in the provincial council also I raised this allocation to district hospitals. Normally it comes through the provincial allocation, but you don't, the central ministry to the best of my recollection don't give any direct allocation to the district hospitals.
What we do is depending on the requirements.
Yeah.
We give allocations to
But
RDHs of PD.
Yeah.
For example, now for Mana Hospital we have given 100 million for purchase equipment and 50 million to do the renovation.
Only with the request, on specific request. On a normal allocation, we have not.
Based on the request.
And coming to Honorable Minister, this Chavacheri issue, I think as pointed out by previous people, Honorable MPs, there were issues. Actually, even I have raised some of the issues during the tenure of my office as leader of opposition. But that should have been settled in a different way. So now our Honorable Minister also had requested the present management forget about the past to go to look at how to do the development and to be more transparent. That is more important. So I think the representatives of the people are also here to be transparent, to coordinate with the area people and to see that the process that you are taking is not subject to any comment by the public. Here the issue is because when some comments are made, so some allegations are made, the public got alert and they were supporting it fully. So if there was a transparent process, this wouldn't have happened. The public wouldn't have got alerted to that extent. So anyhow, Mr. Douglas, Honorable Douglas Jaffna had taken initiative to see that it goes smoothly without disturbing any of the activities. And also request Honorable Minister, why not you just pay a visit to the hospital at least 5 or 10 minutes, so that the people of the area, now you are not too far from the hospital, the people of the area would be happy that Honorable Minister had come all the way. No, you need not to go into the detail of any listening to any complaints or anything. Just to make a visit and see, at least the people, I am coming from the interest of the area people, they will be happy that Honorable Minister had come a long way to visit the hospital care. Just think of it. It's only a request.
Good afternoon all, Honorable Minister. I am request
eminent, dominant character in the health sector, and Honorable Parliamentarian Tharmalingam Sitatan, Angajan Ramanathan, Honorable Parliamentarian Charles Nirmalanathan, the Honorable Parliamentarian Sridharan, who left the place, and Representative Honorable the former opposition leader Honorable Thavaraja, and the representative from Honorable opposition leader Uma Chandra Prakash, and the Secretary Health Ministry, who is my long time friend, and DGHS, and the Chief Secretary of Northern Province and Secretary Health, all the team of Health Ministry, all friends, and all the doctors, Northern Province, Dr. Satyamurthy, the Dean of Medical Faculty, and all the doctors and all good friends. It's a great day today because seeing you all again and working with Honorable Minister and the Secretary here, because you know these are the most crucial and difficult ministry and the department in the province. One is the health ministry, other one is the education ministry, because they are the most dedicated serving professional in the province as well as in the national. But even though we have issues, we have difficulties, we have lack of resources, and even though we have so many criticism among the department, among the people. I have worked with many places as a government agent and very short period in the health ministry, and this is second term as a governor in the province. But I know many things we need to improve in the health sector. Always when I have the meeting with my health team, I used to tell them, improve the preventive and ensure the patient rights. These are the two things I used to tell them. But with limited resources, they do maximum service, I know, but there are issues. We accept. We need to improve, as Honorable Minister said. I think we are working together without any boundaries, always working with teaching hospital, working with medical faculty, both leaders supporting us time to time. Even most of every week I used to have discussion with teaching hospital and the dean of the medical faculty. Even I used to visit them. We have several discussions how to improve the health sector in the provincial. And we appoint a team to study to how to utilize the resources in 4 hospitals which was recently opened by Excellency the President in Point Petro, Kilinochi and Maankulam as well as in Vavuniya. And President has given the assurance to upgrade Jaffna Hospital as a national hospital and Vavuniya Hospital as a teaching hospital. I remind Honorable Minister, he also committed to do that. In A9, as the parliamentarian told, as a strip, we had developed the health sector. But there are some lack of things. In Mullaitivu and Mana, we agree on that. On the basis of these difficulties, the ministry and we submitted the proposal to Indian government. India has given a cabinet approval and agreement to support Mannar Hospital with 600 million. Because of the election, there's some delay in releasing of fund, but Mullaitivu also has gone to Indian High Commission. They are very positive to support Mullaitivu Hospital as well. But as Secretary agreed, the human resources will be provided in very short time. We try to serve the people that in our maximum level. We have very efficient team, but we always have criticism as well. When we work hard, people will criticize us. That is our in our government service, we had to face that, but we will continue our service. Especially, we are grateful to the Honorable Minister and the Secretary. I think Secretary visited second time to the province, and I met the Minister when in the ministry I met the Minister with some request. He promised me he will visit to the province. He came here with his full team to see the province and visiting all the hospital, all the district, and he's going to have a discussion with his team and he will look after us. Thank you very much, Honorable Minister, for your kind attention and kind support. We will be very grateful for your future support and assistance. You are the most eminent person and you can understand the medical field because you are a professional in medical field. Thank you very much, your support and your secretary's support. Wish all the best. Thank you.
The first subject, actually, the Minister has also appointed a committee to look at what has happened at Chavakachari Hospital. So we want to ensure that sanity prevails, and also we provide nothing but the best to the patients of the country. So covering that subject, yes, we understand there's a hospital committee as well, and also we will ensure if there's anything unnecessary that had happened in the past, we'll ensure the processes would be transparent. Coming back to the second issue, yes, there have been certain issues in relation to shortages, which we were building up gradually. There were certain lacunas which we are filling now. Out of 800, and you were basically referring to the surgical items, but we were basically concentrating on the drug side of it. But if you mention the particular hospital and also particular equipment, we can look into that one, because there are certain, we have to acknowledge the fact that during COVID and post-COVID time, especially during the time of economic crisis, there have been certain issues in relation to procurement of drugs and medical equipment. But we are fulfilling the major needs. As at now, we know, say for an instance, we are procuring more than 850 drugs to the central government. Out of that, if you go to any hospital and check, it's about 800 drugs that are available, but there are certain ones, 10-15 drugs are out of stock at a given particular period of time. For that also, we have given local allocation for the local purchasing of drugs from the private sector. If it is not so, covering your subject of the surgical consumables, we look into that one. We will let us know the hospital and the particular consumable that was not available, and also on the long run, we will ensure that those requirements are fulfilled.
Sir, is that the islands, there are a lot of hospitals in the island, and right now they are facing a big problem because there is no ambulance boats, and that is something very crucial, sir, because last time a pregnant woman was not able to travel and they had to go bring through the normal boat, and the normal boat people would not allow that. So please consider this. And lastly, sir, on this thing about the grievances, if you could probably possibly create a mechanism to hear the grievances of this Chavakachari people as well, because that way the people also feel that their problems are addressed. Thank you, sir.
Thank you, Honorable Siddharthan. As he mentioned and also mentioned by Honorable Angajan Ramanathan, as a Minister of Health and also as the Central Province Health Ministry, they are looking at the grievances raised by these concerns, but there had been a particular meeting 6 months ago as well, looking to the different requirements of Chavkacha Hospital as well. So we would further strengthen now. Our PD visited me and requested for some additional funds. We also gave some 20 million rupees. If there had been anything that was not addressed, let us make this opportunity to ensure that we address sufficiently and professionally, and to ensure that we provide nothing but the best to the people of the country. Coming back to the third question raised by Honorable Angajan Ramanathan, that we would like to work in harness with the Provincial Council. That's why we are here today, to ensure that we close the gaps and bridge the lacunas, to ensure that we provide the services together, central government and the provincial councils. And we also jolly well understand it's a devolved subject. So there have been so many requests from different parts of the country, not only from the northern province but also from the other parts of the country, to take some of the hospitals to the central government. No, we don't encourage that. Now yesterday we visited Puttalam Hospital. The prime concern was they wanted us to take the Puttalam Hospital to central government. We flatly rejected that one. That's not our policy. Our policy is to ensure the strengthening of the primary healthcare service, and also for the tertiary ones, irrespective of the province, we will try and provide the best from our side. Thank you.
This issue I already raised with you as well as the secretary. What we observe here is two things. One is unwillingness to get in these nurses and midwife position from this northern province. That is the one reason. Second thing, we are unable to find the qualified candidates also. This was the two major issues in getting the people from province. When I was there with Madam Pavitra Venyarachi, we were trying to lower the qualification, but we had some issue with the union. Because of that, we were not able to do that. I think you have the same issue now. I think, Honorable Minister, it is your kind attention to solve this issue, because at least every day, at least I am getting at least 10 or 15 nursing officers as well as the midwives with a crying face. They want to go back to the original places. It's really hard to have them here, because there are some reasons we are not able to avoid it.
Also about your requirements, actually, yes, that was a concern. We, while watching the presentation, we also saw that. But unfortunately, for the cadre creation, they didn't give approval in last 2 years. Now we need to. That's deemed necessary. And we have raised this matter with His Excellency President as well. And President has promised us to create new cadre positions for those the required posts. So this is the issue not only in the northern province but also in the country. But we will give some priority for your province as well, because that's the priority of the President as well as particularly given moment. Honorable Governor very well knows about it. And also about the recruitment of nurses to this particular, that's a concern, because most of the nurses are recruited by entirety of it, actually by the ESETS core. So greater number of nurses are recruited from the other parts of the country. So once they are placed in northern province, they want to go back to their own villages as early as possible. We will have to check with the management services division whether we can have devise a different mechanism of recruiting nurses from the northern province, so that they can stay in the province for a longer period of time. And also possibly we get approval last week in the cabinet also from Douglas Devan raised this matter about recruiting junior staffers to the hospitals. Possibly President will consider that one and give some approval to recruit at least the minimum cadres at the junior level. And also Honorable Governor also wants to explain about the current position.
Actually, thank you very much, Honorable Minister.
And see the Chavacheri hospital situation. The reason they have some issues, public patat balanona, doctor patat complaint තියෙනවා. ඒ සබතුමා Chavacheri hospital එක ඇවිල්ලා එතන තියෙන situation එක බලනවා නම් හොඳයි කියලා මම ඉල්ලීමක් කරන්නේ. අබ ඉල්ලීමක් තියෙනවා දැන් තෙලිපල hospital, cancer hospital සම්බන්ධ. එතනත් ලොකු complaints තියෙනවා. තෙලිපල hospital එක ICU unit එක නැහැ. එතන ඉන්න patients ලා ගොඩ complaint කරලා තියෙනවා. ඒ නිසා ඔබතුමාට වෙලාව තියෙනවා තෙලිපල hospital පැත්තට આવුත් හොඳයි කියලා මම හිතන්නේ. I want to make some more more points. Even Jaffna hospital also, we don't have the proper ICU beds. Eka increase karut hondai kila mama illima karanne etana gila balana kota ICU beds එක අඩුවෙන් තමයි තියන්නේ. ડોක්ටර්ස් ලා හරි අමාරු තැනට තමයි වැඩ කරන්නේ. කොහොමද බෙඩ්ස් එක මාරු කරන්නේ, patients කොතන මාරු කරන්නේ කියලා එතන තඩුපාඩු තියෙනවා. In addition, ambulance එක මම දන්නේ මේක ambulance කී තියෙනවා කියලා කියන්න පුළුවන්. මම මේක blame කරනවා කියලා හිතන්න එපා. Actually ambulance එක පාවිච්චි කරන්නේ staff transport විදියට. ඔබතුමාට පුළුවන් නම් hospitals ගිහිල්ලා ambulance එක බරණ්ඩ ඇතුළේ ඔක්කොම setup එක තියෙනවද කියලා. මේක නිකන් patients transfer කරනකොට staffs විතරක් තමයි ඒගොල්ලෝ ගෙදර යනවා, duty එකට එනවා, duty off වෙනවා. ඒ ඇත්තටම මේ system එකක් නැති තැනට තමයි ambulance තියෙන්නේ. Already Honorable Angajan Ramanathan and Honorable Siddharth and several people mentioned boat ambulance from the island people. ඒගොල්ලන් ලොකු අමාරු තැනට තමයි ඉන්නේ, especially pregnancy time ඒගොල්ලන්ට හරි අමාරු. ඒකත් බලන්න. In addition, I am requesting some training programs, especially for the nurse staffs. ඒගොල්ලන් patients එක කතා කරනකොට I personally feel අපි එතන අපි සල්ලි තියෙන කට්ටිය විතරක් private hospital යනවා, අනිද්දා government යනවා කියලා image එක තියෙනවා. අපි එතන යනකොට doctors ලා හොඳට කතා කරනවා, හොඳට treat කරනවා, but nurses handle කරන්නේ වෙන විදියට. එනිසා ඒක how to handle the patient, how to speak them කියලා පොඩි workshop එක ඒගොල්ලන්ට design කරොත් හොඳයි කියලා මම හිතන්නේ. In addition, then beds number more than 90,000 තියෙනවා කියලා island wide මෙතන කිව්වා. මම දන්න හැම hospital තනම storage එක තියෙනවා. ඔබතුමා ගිහිල්ලා බලුවාද දන්නේ නැහැ, ලේකතුමා ගිහිල්ලා බලුවාද දන්නේ නැහැ. ගොඩක් hospital equipments අතන දාලා lock කරලා තියෙනවා. ගොඩක් equipments පාවිච්චි කරන්න නැතුව තියෙනවා. ඒක repair කරලා තියෙනවා නම් මේක repair කරලා පාවිච්චි කරන්න ඕනේ, නැත්නම් ඒක මොනවද කරන්න ඕනේ කියලා ඒක බලන්න ඕන. In addition, especially washroom, bathroom hari තැනට නැහැ. Government hospital එක ඔබතුමාට පුළුවන් නම් private hospital washroom එක ගිහිල්ලා බලන්න, government hospital washroom එක ගිහිල්ලා බලන්න. But I want to mention Dr. Malaravan. I went and personally met him and award එක ගියා. එයාගේ hospital එයාගේ especially I went and see the washroom. එනිසා ඒකත් අපි කියන්න ඕන. In addition, I want to mention one thing. We don't have the proper garbage management in northern province. කොච්චර අපි health sector සම්බන්ධ කතා කරොත් garbage management එක හොඳට නැහැ. ඊට පස්සේ especially clinical wastage එක ඒ සම්බන්ධ අපිට හරියට දන්නේ නැතුව we are using polythene, and in addition අපිට මන්නාර් yesterday we went with leader, operation leader මන්නාර් සම්පූර්ණ තියන්නේ polythene. ඒසා ඒකට අපි solution එක ගන්න ඕනේ කියලා මම ඉල්ලීමක්. Moma Chandra representing official leader Sajid Premadasa. Thank you Honorable Minister and thank you Honorable Governor and Lekatuma for your concern about the northern health sector.
Honorable Minister, I just want to say one thing. In 94 Parliament, I represented Vavaniya. That time the war is in the peak, and your late father, Dr. Richard Patrana, he has visited, even during the peak of the war, he has visited our areas. Nobody dared to come there. But he came to Vavaniya, Mannar, and he has done a lot of development work for the schools. I haven't had the time to, the opportunity to thank him. I not thank him, thank you. Because you are the son of him, and you also visited these areas. And you have to continue to visit and develop these areas as much as possible.
So, Dr. Partha
Minister of Health and all the other ministry officials, ladies and gentlemen, it's indeed a great pleasure to be here in Jaffna today, further strengthening the dialogue between central government and the provincial council. In fact, this is the we've been going round the country since we assumed duties as the minister, I as a minister and Dr. Mahipal as a secretary, listening to the grievances of the provincial councils and also the issues pertaining to the health staffers, and also addressing some of the grievances covering the subject of physical infrastructure of the Sri Lankan health sector. As you correctly understand, this is a devolved subject, as I highlighted earlier also. The taking over some of the hospitals to the central government wouldn't solve the issue of
22 million people of the country. So that's why we want to ensure that we work in harness with the provincial councils to ensure that we provide nothing but the best care for the people of the country. So it's a great pleasure. I've been visiting Jaffna frequently since of late. Earlier as the Minister of Plantation Industries, we were doing a lot of work with the Palmyra Research Institute. We were also instrumental in initiating the coconut triangle in northern part of the country. It's good to see that they're doing well. They have planted more than 600,000 coconut seedlings in northern part of the country. Possibly we see more coconut trees than Palmyra trees in time to come when we visit northern province of the country. So covering the subject of health, actually we had the chance of visiting Jaffna Teaching Hospital in the morning. And we were quite amazed to see the services provided to the people of the area by the medical doctors and also the nursing staff and also the paramedics and the other staffs of the teaching hospital of Jaffna Peninsula, for which we are very grateful. And people of the country and people of the northern province are also very grateful, despite some of the bad publicity given because of one solitary incident that had taken place. So I take this opportunity to show our gratitude to all the health workers and also to make note of whatever that is given in the erroneous or bad publicity of the health sector. You shouldn't take that into serious consideration. That's how it is. I, as a minister, had been targeted several times by the media, also about different things that had happened in the country. But you know, as long as you know hearts to hearts that you've done the correct thing consciously, you don't have to worry about that. So let us do our good work. What is the good work? We, as a country, we have recorded some of the highest and best indicators in the health segment, as highlighted by Secretary Health. Our life expectancy of birth has gone up to nearly 8 years. That's the best in the region, and also we, as a country, we are harboring now one of the fastest aging populations of the world. Something it's greatly to the thanks to the people of the country and also to the successive governments of the country. Whatever the difficulties financially we have encountered historically, all the governments of the country had provided nothing but the best to the free health and the free education of the country. That's why people of the country consider free health and free education as the two jewels of the crown of the sovereign Sri Lankan nation. So that even this year, in 2024, the Sri Lankan government had allocated 450 billion Sri Lankan rupees for the health sector development. That's the highest ever recorded amount. Hopefully now economic sanity prevails in the country. We should be able to allocate more funds for the health sector development and also similarly for the education sector development. So in that backdrop that we travel to Jaffna, and also I would be failing in my duties unless I mention the intentions of His Excellency the President, Ranil Wickremesinghe, about development of the northern part. In that specific area, he also reiterated the facts that he wants to ensure that he develops health sector further in the northern province. So in keeping with his request, keeping with his remarks about uplifting Jaffna Teaching Hospital to a national hospital, the basic requirements we need to fulfill. We need to have 1,500 beds and also the other certain requirements. We will try and see how best we can go ahead and ensure that his wish is fulfilled in the near future. And also there were other requests made about different hospitals, including Vaunia, Kilinochchi, Mana, and also about Mankulam, also about Point Pedro. We might not be able to fulfill all the requirements that we have made in here, but we will please ensure that we will provide nothing but the best in supporting your cause to ensure that you provide a better quality service to the people of this area. However, in the policy direction, we have taken initiatives to ensure, we are talking to multilateral agencies to ensure that we are providing or further strengthening our primary healthcare services on the long run. But whatever the support that you may require for the tertiary care institutions and sort of secondary care, you will try and provide, because there would be a lot of funds forthcoming, that we are getting about nearly 45 billion Sri Lankan rupees for the next 4 years from the World Bank. That money would be coming to all the primary institutions of the country. And also historically, we shouldn't forget the fact that historically we have done well in most of the primary health care services, especially in the maternal and child care. But on the long run, as we see greater transformation of the demographies, you would be harboring a significant number of elderly population. So that for them, we need to provide better care at the segments of rehabilitation and also the palliative care. Now, Honorable Governor also mentioned the fact that this Mankulam Hospital, which we can develop as a good rehabilitative center for the region. And also on the police wise, from next year onwards, we will take necessary initiatives to ensure that we create at least one palliative care center per district and also one rehabilitative care center per district, because even though historically we have done well in relation to prevention, treatment and protection side of it, we haven't done much for the rehabilitative care and the palliative care. So with the backdrop of fast developing, increasing numbers of non-communicable disease segment of the country, including hypertension, diabetes, strokes, and also cancers, we want to ensure that we develop palliative care segment and the rehabilitative care segment of the country. For all that, we have to work in harmony with the provincial council and all these stakeholders of the Sri Lankan healthcare sector. For that, we are fully geared to listen and work with everyone of the health sector. So I take this opportunity again to thank Honorable Governor and the northern government officials having taken time off to come here and also providing all the facilities for us to go ahead with this discussion. Please be assured, whatever the support that you may require from the ministry's side to strengthen the health services that you provide to the people of the northern province, we would provide nothing but the best. Thank you and have a pleasant day.
சாவகச்சேரி ஆதார வைத்தியசாலையில் இருக்கக்கூடிய பிரச்சனைகளை நேரில் சென்ற ஆராயுமாறு நாடாளுமன்ற உறுப்பினர்கள் கோரிக்கைகளை முன்வைத்த போதும் அதற்கு அமைச்சர் ரமேஷ் பத்ரனை ஏற்றுக்கொள்ளவில்லை. அவர் அந்த இடத்துக்கு போக மாட்டேன்னு சொல்லியிருக்கார். அவர் வேறொரு நிகழ்ச்சி இருப்பதால் செல்ல வேண்டும் என்று சொல்லியிருக்கார். அந்த இடத்துக்கு சாவகச்சேரி ஆதார வைத்தியசாலை செல்ல மாட்டார் நினைக்கிறேன். இதோட இந்த காணொலியை முடிச்சுக்கொள்கிறேன். நன்றி, வணக்கம்.
Arjuna, where is Arjuna? Arjuna! என்ன purpose minister வந்தது தெரியுமோ? Especially he was visited, especially for this problem, not for other purpose.